Hello, I'm Shane Schultz, and you're listening to the WeGo Health Podcast. WeGo Health is a network of over 100,000 patient advocates, influencers, and experts helping others and transforming healthcare. The following interview is from the WeGo Health Awards Winner Series. Hey, Kristen, it's great to have you here today.
Hey, Shane. I'm happy to be here.
It is really awesome to have you here. Listen, we have an awesome interview. It is one that's near and dear to my heart, and that is the iPain Foundation team of Ken and Barbie and everybody that goes along with it. So why don't you tell me about them?
Yeah, the Power of Pain actually were our best team performance winner for the 2016 WeGo Health Awards. As you said, they're led by the wonderful Barbie and Ken, and their mission is really to educate and support the chronic pain community across the entire world. So they're providing community-based services that really address the needs of all chronic pain patients with conditions such as, post-cancer pain, fibromyalgia, Lyme disease, lupus, and so many more. And their mission is really promoting public and professional awareness of these chronic pain conditions. And that's through educating those who face the condition, but also their family and friends, and most importantly, healthcare providers, just to show and educate how much pain can really disable, everyday patients.
There's no doubt. Listen, I'm an International Pain Foundation delegate. I definitely have the nerve to be heard, so let's get right to it. I am here at the WeGo Health Awards, and I'm sitting here with my good friends, Ken and Barbie from the International Pain Foundation. Hey, guys, how are you doing?
Good. How you doing, Shane?
Hey, Shane. Thanks for having us.
Hey, it is awesome to have you here. Listen, you guys are here for a reason, and that's the WeGo Health Awards. So tell me what award that you guys are up for specifically.
We are up for Best Team Performance.
We're really excited about it.
Yeah, I bet you are. And I got to tell you, folks, I'm an iPain delegate myself, and I have been for quite a while. And the thing is that we don't always get together because we have different schedules of the things that we do with the Speaking the Heart Radio Network, Arisen Strength, and then, of course, iPain. So it is really cool to have you guys here with me to talk about being part of the WeGo Health Awards. But I know that this is a team effort. And one thing that I really like about what you guys do is that you take things to another level. But before we get into that, how did iPain get started?
Well, back in 2006, we were at a family dinner for Thanksgiving, and each year my dad would have us come up with a project that the family could do to keep us close for the year. And I had been diagnosed with RSD the year before after struggling for 3 years to get a proper diagnosis and going through all kinds of treatments and such. And it came up at the Thanksgiving dinner meeting. They wanted to help other patients because if I was struggling to get a proper diagnosis, it was going to probably be just as hard for other people to get a proper diagnosis. So that's where the idea was born at that dinner.
It was born out of a need because everything that we were going through personally.
Right. And so my family decided that we were going to start the foundation. And at that time, it was called the Power of Pain Foundation because pain changed my life. It changed my family's life and Ken's life. And
we discovered how much power that pain actually does have.
And that you can use that power to become a better person and a better patient so that you can get better daily care, which is missing from a lot of people's lives. So that's why it was started. Quickly, we found out that it was not just RSD patients having these same troubles, but all people with chronic pain and nerve pain specifically. So we expanded after the first year to involve all chronic pain and nerve pain diseases. And there's over 150 diseases. So that was a big jump that we made. And then through the years, we started growing, and our board members grew outside of the family as the foundation
quite honestly,
grew.
outside of the country.
And outside of the country.
And we started getting a lot of interaction, outside of the country, which was great. And we're really trying to incorporate as much as we can and thinking how can we, new ideas, all this stuff is going through our heads, and then we discovered really that it's time to make that jump.
From Power of Pain Foundation to International Pain Foundation. And we go by iPain for short. As you said, you're an iPain delegate. Our delegate program has changed over the years. We also have volunteers. So if you don't have the time to dedicate and be more involved as an iPain delegate, you can be a volunteer, whether that be for social media or a committee, in particular like the November Committee or the Advocacy Committee, or you can do the in-person events. So we have a lot of different ways that people people can get involved at different levels. We've been international in reach since probably 2009.
Yeah, it didn't take
really
long.
Grew to 2011.
Didn't take long to, I mean, with the power of the internet, it doesn't, and you have something that is of interest to so many people. Mm-hmm. And 1 in 3 people in the U.S. have chronic pain. And think of what, it's 1 in 7 in the globally, aspect of things. So it doesn't take long to find others to speak up from, their location whenever you have the internet. It's just no boundaries, no borders.
Right. And we're so excited about this award because we do take pride. I grew up being on gymnastics team and cheerleading teams and dance and using a team effort in everything that I did. And so coming from an athletic background and a team background, to be up for best team performance is really exciting for us because we took those skills that we grew up with in athletics and put it into the foundation and try to do things that are a little bit different, a little bit outside the box. And I think that's what attracts people to following iPain and getting involved and participating, because we do projects that are fun and outside the box.
Yeah, you definitely do that. There's no doubt about it. And we were really privileged to have you on my show with Arisen Strength. We actually did a full month's worth of November awareness, and it was really very cool to talk to a number of people who are part of iPain in order to be able to describe what it is that they go through on a daily basis and how it is that they manage things and how they're able to be more than the challenges that they face, which is really what it is that we try to do on my show all the time. But with being a WeGo Health patient leader, you guys are taking things to a whole other level. I mean, you're taking it past bringing awareness from the social media aspect of things. Of course, you've been doing things for quite a while, right? It's been 9 years or so.
10 years.
It's fully 10 years.
Fully
Okay.
10 years.
Wow. Okay. All right. Well, congratulations on your 10 years. So with that being the case, you guys are doing a little bit more than just going to social media. You guys are taking it from another aspect of things. You're doing other different things that I want you to talk about to let the audience know what it is that makes you guys different from everybody else. Like there's a number of different things that you have in production here in 2016 that has really come to fruition for you guys, but it's been a lot of hard work over the years.
Yeah, no, we're really excited about it. To see, gosh, there's so much to talk about right there.
Our biggest project to date came out this year, just a few months ago, called Music Moves Awareness.
And Hope is True, which is a song that we created and put together and has been very, very well received. And I think you played it for your audience as well.
Yep.
So that's great fun, and it's always allowed us to reach out to anybody. It's not in one direction. It's across the entire board. It can fit into anybody's life, anybody's situation that may be going through chronic pain challenges or even emotional pain challenges.
Yeah.
So we're really excited about that. And our projects that we do, we try to make very broad so that anybody can participate.
Right. And with Music Moves Awareness, there's so many different aspects to it. We have our patient featurettes where we feature 24 patients that talked about their chronic pain and their diseases and how they're getting through daily living and overcoming their challenges. And each of the featurettes is in different places, as you have featured many of the featurettes on your show. But it also includes educational series, webinars.
Webinars are great.
And so we're doing a webinar each month, and we're going to continue that through at least 2017. We also have our Hero of Hope Awards. And of course, Ken said Hope is True, the song, but we also have a music video that we use the silhouettes from America's Got Talent, NBC.
And that helped us brand the song to our foundation and what the image is that we want to get across to people. Because you can take the song and use it for this or use it for that and use it for this. And so the video really gives it our touch of what we think the song meant to us. If you haven't seen the video, take a look at it. It's great. I think it turned out. I'm really impressed how it turned out. It's very meaningful.
And the song never mentions the word pain. And we're the International Pain Foundation. So some people found that a little bit odd, that we have a song, a theme song, and it doesn't talk about pain. It talks about hope.
It's all about hope. It's about hope because, when you talk about pain, you start, tunneling yourself into a direction that other people don't want to hear about or, well, that doesn't pertain to me. So the song pertains to absolutely everybody. We're really excited that it has that kind of a reach. It's really a hard thing to do. Putting the song and the lyrics together is like, what if? I mean, it takes a lot of brain power.
Yeah. And since the song launched in September 1st, we have been on radio airplay and we have not been higher than the top 100. So basically
and that's a good thing.
That's a good thing. Yeah. You want to be number one. You know, Casey Kasem's top 40. We haven't broken 40 yet to make it into the top 40. But we are floating around. 100. Yeah, we haven't been over 100. We're floating between 42
is our lowest. That's our benchmark.
And 86. But we've been, since the song came out, in that top 100, and we're very proud of that on radio airplay.
And we just keep finding different ways to push the song out for people to be heard. We don't have the budget was really going towards creating the song. Some budget went out to marketing, but it takes a tremendous amount to break into that top 40 mark is what we've discovered.
We're very proud of where it is and that it leads back to International Pain Foundation. And so we're planting seeds in society so that when people go, oh, I love this song, it's so catchy, because it does get stuck in your head.
And then they see the video.
And then they see the video, and then they.
One other thing I do want to mention this, and this is really kind of neat, is that we've incorporated. We do a thing called balloon pop, iPain pop, which is another thing that anybody can participate in. I won't go into the details, but we actually, when you watch the video, we've incorporated balloons into the video so that it is there and it has that tie. So it all pulls in together when people discover all of the projects that we do. It's like, oh my God, so many of your projects are just right here in front of me. I didn't realize, and it becomes
multifaceted.
Right. Yeah. And so that was kind of neat to mix things into it.
Right. And we also launched our magazine. I know you're like, I can't say a word. But we also launched our magazine, iPain Living, this year, and our first issue is out with Allie Hilfiger, and we have some great cover people for 2017 arranged, and looking forward to getting those issues out as well.
One of the great things about the magazine is it's in a digital format as well, and we pass that out through social media as much as we possibly can because it's such an easy way to get our magazine in somebody's hands with just a link, and then they open the link and they can flip through the entire magazine.
Speaking about digital format, Arisen Strength is on your digital format as well, isn't it?
Yes, absolutely. We have an app, created an app, and I have on the app your entire podcast on the app. So
because we love it. It's very inspiring.
Do such a great job, and I want everybody to hear it and contribute in any way that we can with our technological advances, right?
Well, I want to say, it's a great honor to be part of the iPain Foundation. As far as being on your app, I just want to make sure that you understand that, hey, we're very appreciative of that. To be able to bring inspiration through awareness and motivation through our show to people that follow you as well is just so awesome. It just allows us to be able to get to even more people than what it is that we were able to get to in the past. You also have clearly made an effort to say, hey, this is a team effort. I mean, when you're talking about the things that you're talking about, you're doing some major production studio type of efforts. So you're talking about a big team in regards to what it is that you're getting done. But it all starts with the iPain team. So why don't you go ahead and mention some of the people that you want to mention for the team aspect, because this is a team award from WeGo Health Awards. You must be doing something right, because WeGo Health is definitely impressed with what it is that you're getting done. And Barbie is up for the Lifetime Achiever Award. So, we get to see how that goes too. So you must be doing something right. So tell me who it is that you want to acknowledge.
Well, so many people, like you said, just with our Music Moves Awareness projects, there's over 100 people involved. Our iPain delegates, we have Amanda Comstock, she's a doctor, Amanda Green, Cindy Serta, George Cross, Ian Potts, Jody Dragon, Judith Flanagan, Jillian Phillips, Lacey Fowler, Shane Schultz. I always forget to say Ken, so I'm going to throw him in now. Ken Taylor.
Right.
Lisa Dowling, Melissa Collins, Dr. Melissa Garrity, Rachel Smith, who is our November director. We have Simon Briggs, Sue Hahn, Suzanne Wilkinson, Tina Carlson, who runs our Suicide Awareness Project, Tracy Lundy, who's also one of our featurettes. Goodness.
Jennifer Brand.
Yes.
Adela.
Yeah. Carta.
Adela.
Yeah.
Gail Taylor. There's so many. The list keeps going. Lynn is the one that put the video together with the silhouettes, and she lives with chronic pain as well.
And 4 of the dancers from the Hope is True project, the 4 main dancers, all live with chronic pain. So we thought that was important to
Yeah, and the list just keeps Tracy Lundy, Suzanne Wilkinson, Shannon,
Emily Covington.
The list just keeps going.
In other words, it's a big team, and you want to make sure that everybody.
It really is.
Yes,
BJ, let's not forget BJ
Hawkins.
Yes.
Yeah.
And sure that everybody feels the love.
And for all the people's names that we didn't say, there's so many names that
we wouldn't have time. It would take up the whole program.
And more. But thank you to everybody, because this is a full-on team effort, and everybody does their part. And I think one of the things that makes iPain a little bit different is we don't put a mandate on our delegates and volunteers. We say, you come to us as you are, and you participate as you would like and as you can. And I think that really has made a difference in our participation numbers and giving people a purpose so that their best talent and assets, like you're really good at hosting and you've done some shows and some podcasts with us as the host, but also you're right in there as a delegate as well. And so what people's biggest talents are is where they can step in and help out. And we're open to any type of project, especially things that are outside the box. And that gets even more people involved.
That is awesome. So what are some things that you have in mind for the future?
Well, that's
a deep subject.
We do have the project isn't it? We do have the projects that are ongoing. And those projects,
webinars.
Our webinars are going to be ongoing, and that takes up some good time. The November can't be ignored. We reached out like 70 million people last November.
47 million. But you can say 70 because that could be our next year's goal. No, the year before
this year's goal is 70 million. So sorry. Yes, we keep doubling. I just doubled it in advance, right?
Yeah.
Okay, the first year we hit 20, the second year we hit 40, and those are just round numbers.
We have only been keeping track of our social media reach for the last 2 years. So
and this
2015 and 2016.
And so it's going to be a bigger part this coming year because of the things that we've figured out how to interact with these different social media platforms and keep them alive. But that being said, November is going to be going.
iPain Living magazine.
The magazine is ongoing, so we've got looking at covers and different articles and stuff. The balloon pop is never going to stop. We got great big plans for the balloon pop and putting air into that project. No pun intended. And then radio shows like your own and so many more. There's enough things that are really sticking that people want to be a part of,
right,
that the team gets larger and larger because of these things are repeat things and they're getting legs of their own, and people want to be on that committee and learn about it and move forward with that project. I want to be a part of that project,
right,
with that project.
One of the things that iPain's done in the past is worked with WeGo on Twitter chats and Facebook chats, and I'm getting to host some, and so are some of our other delegates in 2017. So we're really looking forward to doing that again as well. And things like Rare Disease Awareness Week. We've done things online in the past years for Rare Disease Awareness Week, but in 2017, we actually are doing events in multiple states, in-person events, as well as going to talk to legislators in Washington, D.C. about rare diseases and how those diseases, a lot of them, involve chronic pain, and how we're going to go speak at the NIH network there. So we have a lot of things coming up.
And it's going to be kind of an experience because we're going to go to Capitol Hill and speak to our sitting senators and congressmen, share with them the importance of rare diseases.
Right. And so we'll be partnering with Global Genes on that, as well as we're partnering up with Reality Rally. Ken and I being reality personalities ourselves.
Extreme Time Cheaters.
Yes. We partnered up with a couple of other nonprofits to bring awareness through some activities like Reality Rally. We'll be going out to California for another rare disease project in May 2017. So we have a lot of things coming up. We also have our awareness months that we put a lot of effort into, such as Lupus Awareness Month and Arachniditis Awareness Month, November, Chronic Pain Awareness Month, September. So we also have our regular ongoing projects, but we're also adding smaller projects into the larger ones so that they grow and involve more people each year.
Well, you're definitely going to be busy, that's for sure. Where can people find you?
Oh, goodness. On our website, internationalpain.org, and we also have a calendar of events on our website. So if you just go to
Google and type in iPain, you'll come up with a lot of different things.
Okay.
Or International Pain Foundation.
Yeah, iPain, International Pain Foundation. It'll give you our main website, and it just, there's pages and pages. I mean, it branches out from Facebook and YouTube, and we're doing a lot of things on YouTube, so we can be found all over YouTube.
Definitely moving into video projects even more. I mean, 2016 was big for us in video projects. 2017, we're looking to do even more with original video content and 360 video, drone video. We're on all the major social media platforms: Facebook, LinkedIn, Twitter, G+.
Pinterest, Instagram, Facebook.
Yeah.
Can you tell they're a team?
Right? Yeah. There's plenty of areas for people to fit in with what their interest has, you know. Yeah. If they have an interest in this, chances are there's something that they could fit into.
Right. And I think that's the benefit of iPain, is that we are strong in education, awareness, advocacy, and access to care projects. And so there's something for everyone.
Awesome. So listen, I know that we have a way of being able to say goodbye or sign off when we do our interviews. It's called the #iPainPop. So why don't we go ahead and get this started?
Sounds good. So this is what we say. We say, I have the nerve to be heard. Do you have the nerve to be heard? And we're going to pop this balloon, and then the three of us are going to say, iPain Pop.
All right. So
okay,
ready?
I have the nerve to be heard.
Do you have the nerve to be heard? Hashtag
iPain Pop.
There you go. Hey, awesome. Hey, congratulations for being a nominee for the WeGo Health Awards of 2016. I know that WeGo Health definitely is making a move forward, and I know that you are too. So it's going to be really cool to see what it is that we can do for the new year.
Thank you so much for having us.
Yeah, thank you so much. So happy to be working with you and WeGo.
And Strength and WeGo.
It's so exciting, and we're excited about everything coming up.
To learn more and to join the WeGo Health Network, visit www.wegohealth.com. That's www.wegohealth.com.